Did you know how many conditions can affect your urinary bladder? That's right, this small yet vital organ can be impacted by a myriad of conditions, some of which can significantly compromise your quality of life. The urinary bladder is a hollow, muscular organ that stores urine until it's ready to be expelled from the body. It's a crucial part of our urinary system, working in concert with our kidneys, ureters, and urethra to dispose of waste products from our bloodstream. From infections to stones, from cancer to various syndromes, the bladder can be affected in numerous ways. Understanding these conditions, their symptoms, and potential complications is essential for maintaining good bladder health. It's also crucial to remember that while some symptoms can be common across different conditions, each individual's experience may vary. So, let's dive into the different conditions that can affect your urinary bladder. First, let's talk about some common conditions like urinary tract infections, bladder stones, and bladder cancer. Urinary tract infections, often shortened to UTIs, are a frequent culprit of bladder discomfort. These infections, specifically known as cystitis when they occur in the bladder, cause inflammation and irritation. The main symptoms you might experience with a UTI include a frequent need to urinate, a sense of urgency when you do, and a burning sensation during urination. UTIs can usually be treated effectively with antibiotics, but if left untreated, they can potentially lead to more serious complications like kidney infections. Next up, bladder stones. These small hardened deposits can form in your bladder when minerals in your urine crystallize. These stones can cause pain and may lead to difficulties with urination or even blood in your urine. Treatment usually involves either breaking down the stones into smaller pieces or removing them surgically. To prevent bladder stones, it's important to stay well hydrated and empty your bladder regularly. The third condition we are discussing today is bladder cancer. This is a type of cancer that develops in the lining of the bladder. Symptoms can be similar to other bladder conditions and include blood in the urine, pain during urination, and changes in urinary habits. Bladder cancer is often detected early because of these noticeable symptoms and can be treated with surgery, chemotherapy, radiation, or immunotherapy. Remember, it's crucial to listen to your body and consult with a healthcare professional if you're experiencing any unusual symptoms. While these conditions can be uncomfortable and in some cases serious, they are also often treatable when caught early. These are just a few conditions that could affect your bladder, but we have more to discuss. Continuing our discussion, we have conditions like interstitial cystitis, overactive bladder, and urinary incontinence. Interstitial cystitis, also known as painful bladder syndrome, is a chronic condition marked by bladder discomfort and pain. It tends to create a persistent urge to urinate, often paired with an increased frequency of urination. Though the exact cause is unknown, treatment strategies typically center around managing symptoms, which may include lifestyle changes, bladder training, and medication. Next, let's talk about an overactive bladder, or OAB. This condition involves an involuntary contraction of the bladder muscles, which can lead to a sudden and urgent need to urinate. OAB can increase the frequency of urination and even lead to incontinence. Treatment options usually involve bladder training, pelvic floor exercises, medication, and in some cases, surgery. Finally, we have urinary incontinence, which is characterized by the inability to control urine flow, resulting in involuntary leakage. This condition can stem from several factors including weakened pelvic muscles, nerve damage, or certain medical conditions. Treatment for urinary incontinence may involve pelvic floor exercises, bladder training, medication, or in some cases, surgery. It's important to remember that these conditions, while common, require medical attention and should not be self-diagnosed. Symptoms may overlap among different conditions, so professional medical advice is crucial for a correct diagnosis and effective treatment plan. We've covered quite a few conditions, but there are still more to discuss. Lastly, we have conditions like neurogenic bladder, benign prostatic hyperplasia, bladder outlet obstruction, and radiation cystitis. Neurogenic bladder disrupts normal function due to nerve damage, often from conditions like multiple sclerosis. Benign prostatic hyperplasia is an enlargement of the prostate, obstructing urine flow. Bladder outlet obstruction impedes urine flow at the bladder's exit point due to conditions like urethral strictures. Radiation cystitis is bladder inflammation from radiation therapy for pelvic cancers, and that wraps up our list of bladder conditions. So, we've learned about a variety of bladder conditions today. From the common yet often distressing urinary tract infections and bladder stones, to the more severe conditions such as bladder cancer and interstitial cystitis. We've also delved into the complexities of overactive bladder, urinary incontinence, neurogenic bladder, benign prostatic hyperplasia, bladder outlet obstruction, and radiation cystitis. It's crucial to remember that many of these conditions can share similar symptoms, making it essential to consult a healthcare professional for a proper diagnosis. Whether you're dealing with the inconvenient urgency of an overactive bladder or the discomfort and pain of interstitial cystitis, it's important not to brush off these symptoms. Your bladder health is a significant part of your overall well-being. Don't let embarrassment or uncertainty stop you from seeking the help you need. Remember, your health matters. If you have any concerns about your bladder health, don't hesitate to seek medical advice.